Welcome back to our Back to School special. We do continue our conversation on masks in schools with the second panel of parents. We welcome to the conversation now Lisa Logan. She is with Utah Parents United, and Lene Burton. Ladies, thanks for being here. We appreciate your time.
Thank you.
Thank you.
Let's start off with what we heard from Dr. Angela Dunn with the Salt Lake County Health Department. She's going to be recommending masks for students 12 and younger. Your thoughts on that?
Well, I'm actually kind of upset about that because it really should be the parents' right to choose what is best for their kids. Parents should be able to conduct their own cost-benefit analysis regarding their situation and their level of risk. And then it should be their choice, not the government's, whether or not to mask their kids.
The argument here, though, is that those are the children who are not eligible for the vaccine, so they could potentially be vulnerable. Lene, your thoughts on that point?
Personally, I think that all parents should have the right to choose, no matter, basically this is about parents' choice, and parents have the freedom to vaccinate themselves. We're showing, according to all the data that I've seen, that children are not, this virus is not affecting our kids as the media, as everyone is pushing. If you look at the raw data, and we parents are looking at all the data coming from scientists, doctors, there's thousands of resources, and I'm speaking for thousands of parents who we communicate, we share ideas and thoughts, and we're banding together and realizing there's so much more going on. This is not so much about our kids, it's about other people and their fear. This is not about kids getting sick. I know more kids getting sick from other things that this pandemic has caused, mainly mental illness, suicide, vaccine injuries. These things we're not discussing. Everyone keeps talking about masking up their kids to protect them from the virus when the pandemic is driving other problems. And I'm seeing this in my personal life, my friend groups. There's so many parents that are trying to tell their legislators, their senators, their governor, our health department, there's so much more going on and they're not listening. We go to these school board meetings.
Well, that's why we're inviting you to have this conversation here. Lisa, want to get into an important point with you though. Cases are on the rise right now, and data that we see right now does indicate that the Delta variant does impact younger kids more so than the original virus. So with that in mind, many people take a look at your stance and say it's irresponsible. What do you say about that?
Well, when you look actually at the raw data, the narrative that pushes that kids are more susceptible to this disease is actually, and it's more dangerous for kids, is not true. If you look at Primary Children's Hospital, of the 316 beds that they have available, 6 of those are taken up by kids who have a COVID diagnosis. And so this narrative that the media keeps pushing, that kids are sick and dying and the hospitals are overloaded with kids,
hold on a
isn't
sec.
true.
We are not pushing that narrative. We have not reported that kids are filling up the hospitals and the ICUs. However, it has been seen that with the Delta variant, that it is having a different impact on children. The latest numbers from the Department of Health indicate that just last week, 13 children, 14 and younger, were hospitalized because of this variant of the virus.
Right, we have to differentiate why they're being hospitalized. Maybe they're just being observed, maybe they're having some blood taken, and that's the problem. When we take hospital admissions versus like week-long hospitalizations, then we're talking about something different. You have to remember that we had 1 child in Utah die from the COVID, and that child had comorbidities. So when you look at that, and you also consider the fact that every year when we have seasonal flu, we can have up to 2 to 4 children die of the seasonal flu, and we don't require masks then. What is different now?
Let's dig into that a little bit more with the comorbidities. There are kids in our schools that may have that type of a condition. So what about them? When you talk about you don't want any mask mandates across the board, what about those that are more vulnerable?
Well, that's the great thing about Governor Cox's KN95 program you were talking about earlier, is that it provides parents who are a little bit wary of sending their kids to school without a mask an option. And that's what this whole fight is about. It's about letting parents choose. And honestly, if your child has a danger of catching COVID and having a severe reaction, it does not make sense to send them to school in a cloth or surgical mask that does little or nothing to slow the spread of the coronavirus. It does not protect against the tiny airborne particles that are actually responsible for the spread.
Lene, I want to get your thoughts on what you think or see as negative effects on children wearing masks. We have about 30 seconds left.
I don't know if I can fit it in 30 seconds, but I'll try. Starting with the emotional, the social, kids are not living a normal life. We all grew up in we had normal childhood, we had a normal life. This pandemic, it's going to morph into another, we know how this is going to go because we're seeing it happen. We thought we did what we were supposed to do all last year. The masks were hurting our kids in so many ways. Sick tummies, headaches, their social skills, they can't make friends. My little first grader would come home and he's like, I don't know if my teacher's happy or sad. She doesn't know if I'm happy or sad. We don't know what we look like. He didn't know what half the kids looked like all year, and when he would try to take his mask down, he gets in trouble. This is not an environment. This is not a safe haven for our kids. And all the parents who are banding together, and there's thousands that we meet, we gather, we're going to the school board meetings, and they're not listening to us because we're telling them our concerns. This is not healthy for our children. And I understand this is a free country. The people who are concerned, you have the option of homeschooling. There's all these options, but we want our children to live in a normal environment, and our government is keeping us from that.
Okay, we have to move on and end it on that note. I do want to point out that in Salt Lake County, the health department is seeking a mask mandate at this point. It is not a done deal, ultimately up to the county council. Appreciate your insight. Thanks so much for being here with us tonight.
Thanks for
Thank you
having
for having us.
Coming up, Granite School District is gearing up for an unprecedented school year. The superintendent here to talk about back to school plans for one of the largest school districts in the state. We'll be right back.